Good afternoon, everybody. Thank you for joining the Ideal Homes webinar this afternoon. Today we're going to be talking about healthcare, currency and schooling here in the Algarve. So first of all, we're going to start with Lena, and Lena's going to tell you all about the healthcare and how you get that here in the Algarve. So good afternoon, Lena.
Hello, good afternoon. Thank you for joining. My name is Lena Gouveia. I work for IbexInsure Portugal. I'm the medical insurance specialist. We deal with a range of, work with several medical insurance providers, international as well as national, in which we're able to provide a big range of private medical care here in Portugal. I am a true believer that once you come and live here in Portugal, you should register with the national health system, but then also take out a private medical insurance policy to compensate the national health system. As I say, we work with several insurance companies. International ones, we work with AXA Global, a la carte Healthcare, Morgan Price, and IMG. And with Portuguese insurers, we work with Victoria, Lusitania, Allianz, Tranquilidad, and MGen. We can offer medical insurance cover for any age. There are certain restrictions on certain insurance companies, but we do work with one which there is no age restriction. Pre-existing medical conditions may be a concern with some insurance companies, but once again, we have got one that will cover pre-existing medical conditions after 1 year. So if you have any questions, feel free to ask.
Thank you. We have no questions at the moment, so I'm going to go over to Claire, and then we'll come back with some questions if they arise in between. So Claire, would you like to tell us about currency?
Hi, I'm Claire from Moving Currency, and I help people get a better exchange rate when they're transferring funds overseas. So if you're buying a property, if you're sending over money for bills, if you're sending over your pension each month, any payments that you need to transfer, we get you a better exchange rate than you would get with your bank, and we just make the process really simple for you. At the moment, the rates are quite good. And we monitor the rates on your behalf. So if we know that you've got a big payment coming up for a property purchase, for example, we'll monitor the rates for you and let you know the best time to transfer the money, making sure the property costs you as little as possible.
Thank you, Claire. And we have no questions at the moment, but I'll come back to you when we do have some. So James, would you like to tell us about the schooling? And someone actually asked on a webinar yesterday about the schooling in Lagos, if there was any around there, and I wasn't able to answer, but if you can help with that as well, thank you.
Okay, well, thank you, Angela. My name is James Denton. I own an international school here in the Algarve. I'm just going to give you a brief outline of the Portuguese schooling compared to the private schooling that I have. The Portuguese schooling is different to, say, the UK. I don't know where all of you are from. But if, say, in the UK, where I was teaching at an outstanding Ofsted school there, obviously you do a range of subjects. In Portuguese school, you generally study Mathematica, Portuguese and Estudo Mai, and then you'll have some optional subjects. If you attend a Portuguese school, your child is pretty much guaranteed to be fluent in Portuguese. I know it from my own experience with my children, having come from the UK. Within probably 6 months, they are speaking Portuguese. At first, obviously, language acquisition is quite difficult. So they tend to just listen, may not speak. But after a few months, children tend to start speaking Portuguese. The private schooling, there are about 6 private international schools here in the Algarve. Over towards Lagos, I think it might be Valverde, the school that's over there. And they range in fees. That's your main barrier to entry, of course, is the fee structure. Generally, they're ranging from about 7,000 a year up to about 12,000 a year. But the difference with a private international school is that your class size will be smaller. So for my school, we limit the class size to 12. 12 or under is the perfect class size for children to learn, I believe, and that's why I started the academy. In national Portuguese schools, generally it's about 28 or 29 in a class. And then obviously we have the COVID-19 situation that everyone's dealing with at the moment. So since the 18th of March, all schools have been closed. There was a temporary kind of reopening towards the end of term. So we've had to do all our lessons online. So we've all now adapted to this new technology, and that's why we're all here today via Zoom, having our webinars now. So we've all become tech wizards. And so for me at the Academy, we've delivered over 3,000 lessons online since March. So we do 40-minute lessons, and we try to keep the schooling going as much as possible. But what I can say from being an educator is it doesn't replace hands-on teaching. If you imagine the schooling situation, you probably may or may not know if you've got children at the moment, whereas if you're sitting at home partaking in online lessons, it's very one way because the adult is talking to the student and the student's trying to engage. You cannot replace being at school where the children are amongst their peers, and so they're learning to socialize and fall out and compete and learn from one another. That's the bit that the tech doesn't support as well. But I tell you what, we've done a really good job, and I think every school can pat themselves on the back for having got through so far 4 months of online teaching. The Portuguese schools in the main, they're very good, but they can be very demanding. You can finish at the end of year 9, which is about 14, 15 years old. One of the major differences I've found from being a UK educator is that for example, their maths is much more advanced than the UK maths. So the UK will go on a step-by-step basis, building blocks and building foundations to make sure that you achieve mastery in the subject. My daughter was doing stem and leaf diagrams at the age of 8, which you wouldn't touch until you were in about year 8. So you wouldn't touch until you were 13 or 14 if you're in the UK environment. If you're from America, I know you do SATs papers, SATs exams with the critical thinking and the reasoning and the maths. There are SATs offices dotted around Portugal, so you can continue the American online version. I know of students that I've had that want to do scholarships in America for golf, and so they went to Lisbon to sit the SATs test to get into university. So you can continue your education in parallel, even though you are over in Portugal. So I hope that's given you an overview.
Thank you. We have a question. Someone's looking to move to Albufeira, and they have sons aged 6 and 8. They're weighing up the international schools versus the local and wanted to know whether the local schools have catchment areas. Plus, we have not been able to find any information on how good they are. Where can we find this out from?
Okay, well, my children went to school in Albufeira to begin with, so I know pretty well. There are catchment areas. For me personally, it was Montechura. There was a big school there called Dimentina Negrão. Lena may know it, she nodded a bit there. And so you have to go there and register. You have to register for your children, and that will involve taking along passports, fiscal numbers, declarations of health. And so they'll register you. And then if there is an allocation available, they'll give you a school. Now, what happened in my situation was I had 2 children to register. One of them got in at one school, and one of them got in at another school. So we were apart, and that's just the allocation system, in that if there are siblings that are going into that year, the siblings obviously get priority first, and then whoever's left down that pecking order, that's how you get in. It's all been changed to online this year. I was talking to someone actually at the weekend about it. It's all kind of an online registration. If you want details of that, I can certainly find that out for you. In terms of the schooling, I mean, my children loved it. They really enjoyed being part of the Portuguese school system. They took the options of music and drama, and they took up French, and they really enjoyed the Portuguese system, because what you do find with private schools is that my son's best friend will live 30 minutes away from him, or my daughter's best friend might be 45 minutes away. The public schools, it's still very much like a local environment. So your best friend will be just down the road from you. So you have that neighbourhood still, and they still keep that community. So there is a big difference from the public to the private.
Thank you. Lena, we've got some medical questions. So you mentioned to complement the national medical with private insurance. Is this necessary with the golden visa? Lena, I don't know if you know, do you understand golden visa and everything?
Not too much, but yes, no, for the golden visa, you do need some sort of medical care. People do take out the private medical insurance. So you do need some sort of proof that you've got medical care here in Portugal. So I'm not the best person to answer the legal parts of the golden visa, but you do need some sort of proof that you have got medical care. So a private medical insurance policy will then kick in for the golden visa. And then later you can apply for the national health system.
Thank you. Also, what happens if we move permanently to Portugal but have existing regular medication and treatment on the NHS? How do we get this in Portugal?
Well, if you become a resident, you can then apply for the national health, and then you will get a doctor in the national health centre, which we call Centro de Saúde, and that doctor can then prescribe the normal medication. So it's always useful to apply for a national health doctor, because you'll be given a número do utente at the Centro, at the National Health Centre, and with that number, you can get cheaper medication. But it's always advisable to apply for a doctor on the national health system so that you can go there and just ask for the prescriptions.
Okay. And with healthcare, are the premiums based on age and pre-existing conditions? Example, a couple of 70 and 68 years of age.
Yes, the premiums are based on age. They normally go up on age groups every 5 years. Pre-existing conditions, as mentioned previously, if it's not a switch from another insurance company, most insurance companies will exclude any pre-existing medical conditions. As advised, there is one insurance company we do work with, a Portuguese insurance company, which is actually a French insurance company which came to Portugal about 11 years ago. They're called MGen. They do not have any age restrictions, and they do cover pre-existing medical conditions after 1 year. All of the others may exclude pre-existing conditions.
We are looking for a country to live in that will not be mandating vaccines for all, especially with regards to COVID-19. What can you tell me about the vaccine policies in Portugal?
Here in Portugal, obviously, from a young age, you do need vaccinations, and the National Healthcare Centre do that for you. And they do recommend you taking the vaccinations, but obviously I do know people that opt to not take them. But you should, I think that's the question, you should really do take them, yes.
Okay, and in Tavira, are there many health providers, or do most people go to Faro or Lagos?
In Tavira, there's the Tavi Clinica plus another one, but the Tavi Clinica is one that I normally recommend because I have got clients that've been there and they really do like the doctors there. That's just a clinic. Obviously, if you do need hospital, you would need to go to Faro, either to the state hospital or to the private hospital, the Hospital das Gambelas.
Okay. And regarding health insurance, would you also recommend an EU citizen, someone say from the Netherlands, also have an additional private policy?
Yes, I know the Netherlands have got a specific healthcare policy, but yes, it is recommended if their existing policy doesn't cover Portugal, it is advisable to take out private medical care, yes.
Okay. And also, can we go back to James, please? We've got a question on schools about how much you would expect to pay in a private school.
Okay, well, they range from about €7,000 a year up to €12,000 a year. It depends upon the age of the child, so generally there's kind of 3 tiers. So maybe your preschool is a bit cheaper than 7,000. To be fair, there's some good preschools. Once you get into the primary, there's usually a fee. Then you go into, I say, key stage 3, but for people who are not sure, that's sort of 12, 13, 14, that it would increase. And then when you get to your IGCSEs or your A levels, or maybe it's like the equivalent of your certificates for Ireland or for America for your SATs, then that's where the fees will go up, because that's the international certificate you're looking to use your passport to go to education in other countries. So it'll be maybe 12,000 at 16, 17, 18. That'll be kind of the maximum. At my school, it's 8,000 is the maximum. So, but there's a difference. In different schools you can go to, you get different tariffs, but generally they're higher.
Okay, when we were saying about the encatchment areas, is there anything like a map that someone could look at? Would the schools be able to supply the areas, or is it just on like regions?
There are a couple of well, from what I remember from Albufeira, there's a couple of catchment areas within Albufeira. They're kind of like a cluster of schools, and there's one big school, and that revolves around it. So they all feed in. So basically what happens if you start your primary school, I think you were saying the children were 6 and 8. So if they're 6 years old, they'd just be starting Portuguese school. But there's no guarantee that they would start at that in that year. It's because it's done from January to January. And so if your son or daughter was born November, December, they may not get in if the class is full up. So sometimes they have to wait. But the schools are really good. I mean, when I went there, I've been here, 11 years now. When I went there, I didn't really speak much Portuguese at all, but there's always someone on hand to help. And they guided us through the system really well. So your primary school would then feed into the bigger school. In the bigger school, there's probably, I don't know, 1,000, 1,200 students at the big school, but all the primary schools feed in. But the main school, the one with 1,200 students, that's where you need to register. I can give you details offline of the one that I use in Albufeira for the people that are asking. And if that's not in the area they're looking to live, then I'm sure that school, Dimentina Negral, will be able to help with the other areas.
Okay. So we're going to go back to Lena now. And can you just tell us about the company you work for again? People missed who you actually work for.
Yes, I work for IbexInsure company. Okay. They're based in Gibraltar, but we've got 2 offices here in Portugal and several offices in Spain.
Okay, and we've got a question for you. So what does the private cover that regular medical care does not? So what does private care cover that regular would not?
Okay, well, on the national health system, you obviously deal with the state hospitals and the national health centres. At times, what I normally say, that both have to compensate each other, because sometimes on the national health, which I presume also happens in any other country, sometimes you need a surgery which they don't class as urgent, but you just want to get it over and done with. And that's when the public system goes in, because the service is much quicker. So you're able to get consultations much quicker. Surgeries are done much quicker on the private health, on the private sector than they do on the national health system. So it's very convenient, and you're able to get consultations very much quicker than on the national health system.
Okay, thank you. And Claire, can you just tell everybody who you work for as well, what your company is?
Yeah, it's Moving Currency. The website is www.movingcurrency.com. It's a UK-based company, but I'm here in Portugal. If you're ever here, then I'm happy to meet up and discuss the currency in more detail.
Somebody's asking what services do you cover for currency?
So we can do forward buying, so we can lock in the rate for you, which means when you buy a property here, you can lock in the rate on the day that you agree to the property, and then you know that's the price of your property, and it's not going to fluctuate with the exchange rates. We can also set up regular payments for you, or just send money over as and when you need to.
So if someone saves money, such as a pension, somewhere else, they can have it sent over every month on a regular basis to Portugal?
Yeah, that's right. And then we just pay it into the Portuguese bank account.
Okay, thank you. If anybody's got any more questions, please do type them in. Hang on, is there a situation that national healthcare, so this is for Lena, is there any situation that national healthcare is better than private insurance cover?
Excuse me. Obviously, you find the same services in both sectors. with regards to, for example, cancer treatment, we've got a very good private hospital up in Lisbon called Champalimau that provides very good cancer treatment. However, obviously, the cancer treatments are very, very expensive if you do it privately. I am aware that the oncology section, for example, here in the Faro State Hospital is very, very good, even though it's the state system. So you do find that sometimes, especially down here in the Algarve, you can find that the certain private hospitals may not have all the equipment that a specific condition might require. And when that is the case, then they do still refer you to the state hospital, either here or they fly you over to Lisbon. So that you can find here in the private hospitals that at times they don't have the specific equipment. So in that case, then they send you directly to the state hospitals. But because you're already in the system, they're able to do that much quicker than if you have to do it privately at times.
Thank you. I've had experience with both private and like the NHS kind of, but and I found them both great. I've always had good service, and everybody I know has always had a good service, whether it be private or for the state.
Yeah, so have I. I've got two children. One was I had my first child in the state hospital, and the second one I had in the private hospital. I can't complain of either one of them. They're perfectly fine. Obviously, the infrastructures are different. The public hospital, you share a room with 4 or 5 people, whereas in the private, you can have a private. On the private hospital, you've got a private room. So the physical conditions obviously are a little bit better. But with regards to the service and the medical provider, doctors and nurses, I've also got no complaints.
I know my sister, she was over and she were in hospital for a while she was here. And she's one that's very critical of hospitals and things. And actually she said if she ever gets ill again, she wants to be in Portugal, because she said the food was good. They even put her next to a Scottish person so they could communicate. I think he might have been a bit disappointed about that, being next to my sister. But she said the treatment and everything was really good.
Yes, I think what lacks in the state system is, for example, say if you break a leg or if you've got a tummy ache, a minor situation, not a serious situation. If you go to the urgency section of on the state hospital, you might wait several hours to be seen, because obviously they put the urgent cases before the less serious ones. I did have a situation with my husband about 14 years ago in which there wasn't the Hospital the private hospital here, and I took him to the state hospital and he just had a pain on his stomach, so it wasn't classed as very urgent, so he waited there for 3 hours on the drip without being seen by a specific doctor. He eventually left and we went to the private hospital in Portimão and he was seen to in 10 minutes. So in that situation, it might be easier going to the private sector. But if it's classed as an urgent situation, like my father-in-law had a heart attack a few years ago and he was seen to straight away. So it all depends on the actual condition.
Mm-hmm. Okay, I've got a question for Claire. So someone's saying, if we want to move a bulk sum to buy a house, would you recommend doing it now or once you find the property, in terms of forecast on the currency?
Well, it's quite difficult to say at the moment, because obviously with COVID, it's quite an unusual situation. So everyone's finding it quite difficult to predict what might happen with the exchange rates. I guess the thing with locking it in now is you know that it's not going to get any worse. That's the rate that you're going to get, and you know the amount you've got to spend. So you know your budget from the start. But it is difficult to predict what might happen at the moment.
How long can you lock it in for?
You can lock it in for up to 12 months, so it gives you plenty of time to find a property as well.
Excellent, thank you. Okay, have we got any questions, anybody? I think we've done with questions. Oh, has anybody got anything to add? James, have you got anything else to add?
I was just listening to Lena there about the medical, and I agree. You know, I've got some experiences of people that have lived here for many years, and they've used state and they've used private healthcare. One of my friends, he had cancer, quite serious, and he started off in the private, And exactly as Lena said, there he got transported to the state hospital up in Lisbon, and he recovered fully. And they kind of worked together, and he was actually given an ambulance from Albufeira and transported up to Lisbon every 2 or 3 days, and it was all paid for by the state, which was brilliant. Regarding like myself, if I want to go, I'll just pop to the doctor. There's like local international doctors, and you can go and see them. There's one in Albufeira, there's one in Valdelova. You don't really want to queue, which is what you're saying about the Centre of the Swords. You don't really want to queue. You maybe pay €20 and you'll just go see a doctor. So you pay 20, but if you've got the insurance, that's okay. You can get it back. But you can go and see an English-speaking doctor, and that sort of puts a lot of people's minds at rest. There are these doctors there that you can phone up and say, look, I've got the sore throat, or I've got something, and you go in, and if you've got the private insurance, I'm sure, as Lena will tell us in a minute, it's probably covered by that. But if not, you just pay €20. You go have a consultation, and they'll give you your antibiotics. And if you've got the cartel du utente, is that right? Your national health NHS kind of number, then it's all discounted. So, and like, a Ventolin inhaler is about €2 or something. It's amazing how cheap it becomes. So just to sort of confirm with the healthcare stories, it's very good over here.
Yeah, it is. The national health system is very good. Just for example, the COVID situation we're going through now, I unfortunately had a scare. So I had to go do a test, just because I was in contact with someone that was positive. And I did research the private care, although my insurance would pay for it. In the Hospital do Lolé, it was going to cost me €140 to do the test. In the Hospital dos Gambales, it's €160. So I decided to do it through the private health, through the state system. I got a prescription from my equivalent to the NHS doctor, the national health doctor, and you can either do it in 2 ways. You send an email to this email address, and they contact you, and you go do the test at the stadium, or you can ring this lab in Quarteira, and they make a booking for you. You take the prescription, and you don't pay a single thing through the national health. So the national health does work, but once again, I do believe that both have to work together, because in certain situations, if it's urgent, you first start off with the private care, and then if need be, then you transfer to the state system. So the process is much quicker, I think. So both have to work together, yes.
I believe
if you're talking about the COVID as well, I think it needs to be mentioned that it's been really blown out of proportion. Everyone's saying that Portugal's bad. It is not bad. They have really dealt with this COVID-19 extremely well. I mean, even before the president gave the state of emergency, the Portuguese people, just by nature, were already self-isolating. People were already not going to school. And so when he announced that, from my experience, the schools are going to close, a lot of the children weren't even coming in anyway. We were already starting on our technological route of teaching. But people stayed away, and they've dealt with the coronavirus extremely well. There's been hardly any deaths in the Algarve, really, when you compare the amount, when you've got a hub like Faro and a hub like Lisbon, and all the flights coming in. It's been fantastic the way that Portugal have dealt with it. Unfortunately, we've had a couple of incidences where teenagers are getting together, and they'll be going out on the beaches and meeting up, because, of course, they're frustrated they can't see each other. But these groups where they've come together and then created positive cases has caused this kind of explosion in the press of don't visit Portugal. I think it's ridiculous. I think it's scandalous that they're not giving us an air bridge to the UK or to other places, because, to be fair, Portugal are one of the best at dealing with it.
Yeah, they are. Just to give you an idea, with this COVID process that I went to, I had people ringing me every day, although I didn't have any symptoms and my tests were negative. The person that was positive, a police would go to their house every single day at random time to see if that person was in their house. So they're keeping a big control of the people that are positive. They're keeping a big control of those people to make sure that those people are not in contact with other people. So they're dealing with it in a very, very, very good way. Totally agree with James.
Yes, totally agree. And the Portuguese are like you say, they're asked to do something, they do it. Yep, they don't argue it or try and do something different. They actually do just get on with it and do it. It's the way they are.
That's right.
also back onto health, there is some cases as well, is it like if people have diabetes and things like that, that they will get certain free treatment?
Yes, certain treatments are for free. As I say, if you go through the National Health, they will see that they get much cheaper medication, and there are treatments that are for free, yes.
Okay, so if anybody wants that you will be able to do people like a quote on the health insurance for them, so that they can just get a quote and decide on whether that's something they want to go and do.
That's right. They just have to send me their names, the dates of birth. If they have got a Portuguese fiscal number, that is useful for the Portuguese insurers, and their address. And they can send it to my email address, which is lena.gouveia@ibexinsure.com. But I'm sure you're going to be, they can send it to me directly or via yourselves.
Okay. And I do advise it. I think it's something that you don't realise you want until you need it.
That's
and
right.
It's not that easy to get suddenly. So it is kind of one of those things. It's like, I wish I'd done it. So I think people need to do it.
Yeah, and what I tend to see is people, when they're in their 20s, 30s, or even 40s, and I speak about myself as well, I only took out medical insurance after I started dealing with medical insurance, because you always think, oh, you know, I'm healthy, nothing's going to happen to me. It only occurred to me, and even though I was selling it, when a client came in my age, she did the insurance, and then a year later she was diagnosed with breast cancer, and she was my age. And I thought, well, obviously we covered on the national health system, but as I say, it's always good to have this backup so that treatment can be started before the national health. So it's always advisable to take it out. Yes.
Yeah, and you cover, you'll have cover for dental and opticians as well?
There are different policies. Each insurance company have got different types of plans. So you can always opt to include dental cover as an optional cover, as well as ophthalmological, so glasses and lenses, etc. So there's different packages. So depending on what the client needs, and then I just send them several. What I do is I do a comparison with several insurance companies, because each one's got different levels of cover. So I look at several insurance companies depending on the client's needs, and then they can compare. And we can always arrange a personal meeting as well if they're down in the Algarve.
A question for me. So if I had my eyes lasered, and I could go private to have that?
Certain insurance companies exclude laser treatment, but there are others that do include it. So it all depends on the situation. And obviously, if you've already got that problem, as I say, certain insurance companies will class it as a pre-existing condition, so they will exclude it. But there are one or two that may include it, yes.
Okay. Okay. Has anybody got any more questions? So we've Tia's put on everything that everybody's contacts. So please do get in contact, ask us more questions. We can talk to you one-on-one if you'd prefer us to give you more personal advice. So remember, Lena for health insurance, we have James for schooling, and Claire for currency. Claire, James, and Lena, have you got anything else to add?
No.
Really good.
Okay. So thank you everyone for joining us today. And I'm sure we'll see you and speak to you again shortly. Have a good day. Thank you.
Thank you. Thank you.
Bye.
Thank you.